Have you ever wondered why your doctor won't run the tests that you're asking for? I have a lot of opinions about I have a lot of opinions about why this happens. But one of the reasons this happens is because they don't know what to do with the tests once they run them. I'm not kidding. They really don't know what to do. And so they would rather not run them than get a test that they can't interpret and do anything with. I know, it doesn't make any sense. So half of my job as a naturopath is convincing other people's practitioners to agree to order this testing because I know how to interpret it. Also, it's not a difficult thing to do. And one of my favorite things to do is teach my patients how to interpret their own labs so that they know how to advocate for themselves in these visits. This exact same thing happens to family members of mine, people who I actually have collaborative efforts and relationships with their physicians. I have to teach a doctor why the testing we're running is important, and that's if they're open to it, which they aren't always. And then I kind of get the chance to convince them that it was their idea to put the patient on the supplement or medication that I recommended to begin with. I mean, it's a little manipulative, but we've got to get around the system somehow because you won't get what you ask for unless you know what you're talking about. Your doctor won't run the labs that you're asking for also because of insurance. If you're trying to go through insurance, there is so much red tape to cut through to have the labs ran that you would like to have run that they just don't bother. They don't bother looking up ICD-10 codes. They don't bother with prerequisite testing. They don't bother because they don't want to get a call from your insurance company asking why they ran that test. And then God forbid the test comes back and it's not outside of a lab reference range, you could get stuck with a $2,000 bill. It's unfortunate, but that's our system. I'm Dr. Britnei Artz. I'm your other doctor, and I am here to help you navigate this system because it won't work for you. You have to make it work. You pay for it, and I will help you make sure that you take advantage of what you're paying for.